Hello, I am Dr. Mirela Cernăianu, and I welcome you to the Wellness Optimizing Warrior MD podcast, the WOW MD podcast. I am not your typical wellness coach, and this is not a typical wellness podcast. Here, I'll discuss educational facts about health, hormones, intimacy, anti-aging, and beauty trends, all very hot topics, to empower you to make great choices when it comes to your health and to your body. I want you to go, wow, I did not know that. Or, wow, this is going to make a great difference for me. Our healthcare system is broken and it needs a revolution. You and I can start one today. I am willing to share my knowledge with the world if you're willing to listen. Let's get started. Hello, listener, and welcome back to another episode talking about specifically concierge medicine. I'm going to pick up exactly where I left off in the previous episode, where I talked quite a little bit about physician burnout. And I did give you my own personal opinion about why doctors are falling out of love with the practice of medicine. To sum it up, there are many reasons, financial and non-financial. And in the previous episode, I closed by explaining my own take on why doctors are getting burnt out. And I do hope I drove home the fact that we are more and more treated like second-class citizens by a lot of the administrators, sometimes by patients, and sometimes by our own support staff. The truth is, doctors are getting more and more burnt out by this healthcare system that demands a lot and pays very little in terms of finances and in terms of respect or satisfaction. This is a system that pays doctors who perform critical surgeries like a bypass surgery, a spinal fusion for your spine, or a hysterectomy for cancer, much less than what you have to pay to have your car transmission replaced. Think about this for 1 minute. You, the consumer, the patient, will pay more to replace your car transmission than what your health insurance plan will actually pay your doctor for your bypass surgery. What does that tell you? It tells me that our current society and healthcare system values your health and the repair of it much less so than the value of a car transmission. So I ask you, is this fair? The answer is no. It is not fair to you and is not fair to the doctor. Your car mechanic did not go to college for 4 years, medical school for 4 years, and residency for 4 years, and maybe another 2 years for a fellowship. And some residencies are 6 years. So we're talking about 12 to 16 years of training, all starting at age 18 to 20, while taking meager pay and working over 80 to 100 hours a week. And on top of all of that, racking up a huge amount of debt. So what does this tell you about doctors? Doctors have become cogs in a system that is overworking and underpaying them. So no wonder, considering the sacrifices that they have gone through to become the best they can be, get to this point of practicing medicine and helping people, they get here to this point with a huge amount of debt, as much as a house mortgage. And on top of all that, after enduring lots of abuse, physical, mental, emotional, from their upper-level residents and their teachers during residency. As a matter of fact, this type of physical abuse became so notorious, it had to be regulated how many hours you were asked to work as a resident. No wonder, considering all of this, the rate of physician burnout and the rate of physician suicide has gone up. You might not know this, but each year, 300 to 400 physicians die of suicide. And the rate of depression amongst doctors is estimated to be 25%. And 6 out of 10 surveyed physicians complain of being burnt out. I will put in the show notes a link to this article from 2019, which is pre-pandemic, mind you, entitled Physician Suicide, A Call to Action. On top of all this, we got the pandemic in 2020, and that made everything so much worse. During and after the pandemic, a great many doctors retired. or simply decided to close down their practices. Due to the difficulties and huge expenses of running a medical practice, most doctors today decide they want to work as employees for someone else. They work as hospitalists, they work for major corporations, clinic systems like Kaiser, Providence, Sutter, Dignity Health, UCLA, etc., to just name a few. Today, most doctors either go employed and choose to work set hours, get paid a fixed salary, so they don't have to worry about overhead, employment, HR issues, paying payroll, etc. Or in the face of dwindling payments from insurance companies, most private solo doctors or very small private physician groups are going concierge and restricting access to their care for a limited few that can pay thousands of dollars annually. Let's talk about this a little bit more because, as I promised, this episode, I'd like it to be about, is there any future for concierge medicine and why are doctors going concierge? I want you to know that as doctors, we are not trained or prepared to run a business. I've said this before in previous episodes. We doctors know nothing of the complicated business of medicine. And I realized when I started my own private practice that I was swimming against the current in a time when most physicians were joining big groups, closing down practices. I wanted to start a solo practice. I have come a long way in the past 10 years of being in private practice, and it has been an adventure. It has been very exciting and very scary at the same time. However, my only regret is I didn't do it earlier. I always believed I should stay an employed physician. I considered that being safe and being easy. However, working for ruthless and uncaring executives who were making close to almost $1 million a year, when I worked over 100 hours per week and earning less than a third of that, it just simply was not something I was willing to put up with for the rest of my working life. So I changed course and started a private practice. Now, I have battled with the decision to go out of network, name my own price for the past 4 to 5 years, especially since the pandemic. The cost of doing business, the cost of having and managing employees, and the cost of supplies has gone up since 2020 in ways that are scary for any business owner, especially in healthcare. The sad truth is that the insurance payments for medical services have stayed the same or decreased. I would love to simply cut out the middlemen and trim the fat, like I said earlier, on my own and not have a biller, not have an electronic medical record, not have all these other organizations I pay. Just go out of network, name my own price, but then I would only be able to offer my services to the people who can pay for them. There is some guilt and some shame in accepting this reality. This is where my hesitation has been. But here's the thing. I am a doctor. I'm not a business person. I don't want to be a ruthless executive. I don't want to make heartless decisions. I do think with my heart, and my heart tells me to keep going and look for ways to continue bringing high-touch, high-level services that my medical consumer needs and desire. But the bottom line is that is getting harder and harder to do without being creative. Since the insurance does not pay for the high-touch and high-level customer service care, that creates a big conundrum. I want to meet expectations for customer service, but I cannot do that for free. So I simply decided to put a very affordable cost to the in-demand customer service services. So I implemented a monthly membership fee. This is currently, as we speak right now, in February 2024, $39 a month for less than the cost of a steak each month. We offer blood draws in the office, same-day appointments, no cancellation fee for maximum 3 appointments, communication by text with our cell phone concierge lines, access to telehealth appointments on weekends for female health issues, upper respiratory illnesses, GI issues, whatever might ail our clients during the weekend, no fees for admin paperwork, and more. A lot of people are angry with the doctor for establishing a concierge practice, a concierge fee, and they get disappointed, hurt, they're bitter, and ultimately they're angry. The truth is, the concierge docs are not wrong. They are not greedy. They are not heartless. And yes, the truth is you, the consumer, has to pay those fees, but it's because you expect those services. And yes, this fee that you're paying is on top of your super expensive monthly premium, but you have to understand as a consumer, the services that are being offered in the membership or in the concierge practice are not paid or reimbursed or billed to your insurance company. And the difficulties you, the patient, are experiencing with prompt access to great and affordable medical care is because the insurance companies have become extremely greedy, ruthless, and heartless with their monthly premiums, because their monthly premiums have skyrocketed and increased 200 to 500% in the past 10 years, while their payments to providers, as I told you before, have increased by maximum 4% every few years, if it happened at all. I made a comment in the last episode that Medicare reimbursement adjusted for inflation dropped almost 30% in the past 20 years. We talked about doctors going concierge, and I want to touch on the value of the doctor in this healthcare system for a few minutes. So let's take a few minutes and think about a healthcare system where there are no doctors. What kind of healthcare system would that be? No matter how talented and dedicated nurses are, no matter how well-trained and experienced the physician assistant or a family nurse practitioner is, or a chiropractor, they will always be mid-level practitioners. No matter how many advances we make as a society into artificial intelligence, it will not replace a doctor's brain, a doctor's talent, and a doctor's high deductive problem-solving abilities. No matter how sophisticated our surgical robots become, they will be just robots. They don't have the tactile sense and tactile experience. They're not anywhere close to the point of sensorial or visual assessment of what is healthy, normal tissue and what is not, and proceed to remove it with care and precision like a human, experienced, trained surgeon. I personally believe doctors are extremely undervalued and unappreciated. And I think it's worthwhile, coming from a doctor, to make you, the consumer, aware so you can better understand the value your doctor has and will continue to have in the future. Doctors are irreplaceable. And unfortunately, we keep losing doctors to retirement. We keep losing doctors to other professions, like management, which, by the way, pays much better. We keep losing doctors to alcoholism, to medical drug addiction, to depression, and to various other mental health issues like anxiety that render them either addicted to drugs or suicidal to the point they can no longer practice medicine. Let's come back to why there's such a negative perspective on the side of the medical patient, you, the medical consumer, regarding the fact that some doctors decide to go concierge or implement membership fees. Well, doctors can either go along with what is going on in the way they practice medicine that leads them to burnout, or decide to put the brakes and look ahead and plan and decide to do something that puts a value on their time and puts a value on their knowledge and experience. You, the consumer, should know that the doctors go concierge only make that choice because of the way the healthcare system has been built and designed and run by the healthcare organizations and by the health insurance companies. Doctors need to protect their business and need to protect their investment in themselves and in their business. The insurance companies are absolutely predatory because they literally fleece you, the medical consumer, by demanding super high monthly premiums. And they also fleece the doctors by refusing to reimburse them appropriately and underpaying them. It is easy and convenient for you, the medical consumer, to revolt and express your disappointment, frustration, and negativity upon your first line of contact, which is unfortunately your medical practice, whether it's the doctor himself or herself, or the medical staff in the medical team. But the people you are really frustrated with and you are angry at should be your faceless health insurance company or the healthcare organizations who organize the system the way it is and who literally call the shots. By paying very little for medical services, they're forcing medical providers, whether it's a clinic, a group, or a solo practice, they're forcing them to see more patients in a day to be able to afford the overhead, which is outrageous for any medical practice. If you personally think the doctors in private practice are cashing in and making a huge amount of money, you are completely wrong. The doctors who are in private practice have their own personal journey to get there, in the sense that they have made that decision not without some difficulty to start a private practice, because they have faced disappointment, frustration, all sorts of negative emotions while being employed. They've been placed through the ringer of working through the demands that the faceless administrators imposed on them, how many patients you should see, how many tests you should order, how many clicks and boxes you need to check for every visit, how many charts you need to review, etc. And they're absolutely done with all of that. More so, these doctors want to bring their own creativity, their own talent, and they want to put their own personal fingerprint on the way they want to practice medicine. Most of the solo private practice doctors have a unique view and a unique talent that they want to share with the world. This talent might not be for you or resonate with you, but it will resonate, and it does resonate with a lot of other people. And that's why they are successful. Unfortunately, doctors have to insulate themselves and have to set standards, not just standards for higher excellent customer care and higher level excellent medical services. They also need to set standards for higher excellent pay from you, the medical consumer. Because the faceless medical organizations that you pay your monthly premium to are refusing to pay the price of what is fair for that doctor's talent, that doctor's experience, and his or her unique approach to the practice of medicine. Please don't hate the doctors who charge you cash for their services. They're only doing so because they are fed up with the system. And by participating into the system and choosing a plan that fits your budget, that's cheap, that doesn't really provide much coverage, but at the same time, by expecting a lot of free time and free care from your medical provider who is not being paid for providing you with any of these services, you are unknowingly and unwittingly contributing to this huge problem in healthcare today. In my opinion, it's a very skewed approach of expecting a lot of free stuff just because you're paying a huge monthly premium. In reality, your medical team and your doctor is not paid for customer service and is paid very little for your visit. And again, on top of the visit, the practice gets paid $0 for any time that either the doctor or the medical team spends with you, helping you outside of your visit, once you left the practice or before you even get to the practice to see the doctor. And this expectation of expecting a lot of free stuff that will happen before or after the appointment will need to change. And this change will have to start with you, the medical consumer, and your understanding of what's going on. And if you believe that a concierge fee or a membership fee is unreasonable, then you don't really understand this. But I really hope that after this podcast episode, you will be better prepared to not judge and not have a negative view, and instead consider the fact that by choosing to participate in your high monthly premium insurance plan, which enriches the faceless people that run the executive boards of the insurance company, you might be contributing to this problem. Obviously, you are not contributing intentionally, but by buying these plans, you are contributing to the status quo. If you would understand and see through these plans and accept them for what they are, which is simply catastrophic insurance, you might choose different. You might decide to choose a very high deductible plan for a lower monthly premium and take and save your money to spend them on a type of healthcare that promotes wellness, that promotes hormone optimization, anti-aging, or beauty procedures. We definitely need those as we get older. I promised in the trailer episode for my podcast that I'd like to start a revolution. You can't really start a revolution with one person, but that one person can plant a seed. If you understand that there is a problem, but you keep behaving the same way and participating in whatever creates the problem day in, day out, year after year, you will be doing nothing to fix the problem. The doctors who are the people providing you with medical care and medical services have decided to fight back against this system. And their way of fighting back is by establishing concierge practices or implementing a membership fee that covers the extra care that you, the client, feel you deserve, but that your monthly premium for your insurance plan will not buy you. As a consumer, you buy a medical service and pay a monthly premium for it. That's the visit which occurs face-to-face between you and the provider, the procedure that's being done by the provider for some medical condition. However, as a consumer, you expect a lot to happen in between the time you call to set up the appointment and the time the medical service will be delivered, which is the face-to-face consultation or the procedure with your doctor. You might have expectations for the staff to explain to you about the practice when you join. You expect and you might need the time for the medical staff to register you as a new patient. The staff might need to sign you up for the patient portal. The staff will probably need to send you paperwork, spend time selecting the paperwork and sending it to you by email. Or they might need to spend time on the phone educating you where you can find the paperwork on the website for the practice. And consider that after all of this, you might decide not to show up at all. So that time spent helping you out was useless, not billed, not reimbursable by any health insurance plan, and an example of wasted time for the medical practice. Now you might have to pay a cancellation fee, which most practices have implemented and follow through with it. As a patient, when you join a medical practice, please take a minute to consider the effort, the time, and the hard work that is going on behind the scenes to keep the practice going, to keep the medical staff employed and happy in their positions so they can joyfully and pleasantly serve your demands as a consumer. Let me give you more examples. You have seen the doctor and you have a ton of questions after the visit. Any conversations that happen with medical staff or the doctor after an appointment are not payable and not billable to your insurance company, but you expect them anyway. Consider this. When health insurance payments were fair and your insurance plan reimbursed physicians appropriately, all this time spent on you, the client, outside of the appointment was also fair. But today, in this day and age, considering how meager and low the reimbursement for a visit is, it's not worth the effort or the time for a clinic or a practice to communicate with the patients outside of a medical visit. And again, I'm going to repeat that. In today's day and age, because of the low reimbursement rate for a visit, it's not worth the time and effort for the clinic, the medical staff, and the doctor to be able to communicate with you outside of a medical visit. This is why you can never get a real person on the phone. or get to communicate with your doctor unless you have a doctor visit. Consider the fact that the insurance company pays the doctor $60 for a 20-minute consultation, maybe $100 for a 30-minute consultation, and about maximum $175 or $200 for an almost hourly consultation. At these rates, it's simply not feasible, not realistic, and downright foolish to expect your medical practice to have the ability to pay for medical personnel to answer your questions, serve all your needs that are not part of that appointment, that are not billable and not reimbursable. Now, I really hope this information and these facts open your eyes as to why medical practices and doctors are doing business the way they are now. Now, do I have an answer and a solution for you, the consumer? Not really. But I know that by continuing to pay your monthly premium and selecting the plan that provides minimum coverage and having super high expectations of delivery of high-end, high-touch customer service from your medical provider who is not paid appropriately is absolutely foolish. Maybe if more people would go cash only, save their money, and pay for medical care that is excellent, that would enroll in concierge practices that provide the care that they want. They would pay the membership fees to belong to that practice that they have established trust, have a relationship with. Maybe if less and less people would buy these exorbitant monthly premium plans, then maybe the faceless people that run these corporations would get the message. Maybe you can change something. Maybe you can educate someone else about this and spread the word. Maybe if us doctors, the ones who are in private practice, would stop accepting insurance plans, that would also be a message. Being one of those physicians that still accepts insurance plans, I can tell you I've been faced with the dilemma of going against my belief that I should help everyone I can afford to help. But on the other hand, I want to protect the business that I created, which is my practice. And I want to protect my medical team who relies on me and who relies on how much money we bring in to actually make payroll. Consider the fact that the employees that work for a medical practice are people with faces and names and jobs, and their livelihood depends on the medical team leader, the doctor, doing a good job, running the business, making it profitable, and allowing them to put food on the table for their family. There's a lot that goes on in the mind of a doctor that has and owns a medical practice as a business. There are a lot of decisions that have to be made that sometimes are not easy, and I have been confronted with this dilemma for the past 5 years. Go cash only, go out of network, name my own price, and see only the patients that want to come to me. However, I'm struggling with this decision because I feel I would restrict myself to only the people that could afford me. And I literally would feel guilty and ashamed for doing so. I would like to continue to offer care to Medicare clients and to PPO clients. However, it is disappointing to me to realize that people have minimal or no understanding and no clue as to what goes on behind the scenes and what it takes to run a medical practice and the decisions that we have to make on a daily basis. The truth is, and probably a lot of concierge doctors feel the same way, I want to help heal people. And in my opinion, I don't necessarily want to help and heal only people who can afford me. I really enjoyed working for the community health center. I loved the patients. I loved my medical team, my physician colleagues, but I absolutely hated the administration and the way the community health center was run. The decision to establish a private practice was easy, but continuing to run a private practice that accepts medical insurance in today's harsh healthcare environment, low reimbursement rates, growing patient expectations for concierge care without needing to pay for it, it has been very difficult and not without challenges. However, I realize that as a team leader, I need to keep the practice and the team constantly evolving, learning, adapting, and implementing new ways to better serve our patients, but also get paid for our services. So out of this necessity and belief, I decided to implement a concierge fee. Now, I'm not sure what goes on with other doctors that decide to go concierge, but maybe This will help you, the consumer, understand these doctors. I would like to talk a little about how clients, you, the medical consumer, might receive the notice that your doctor has gone concierge. Well, some of you might judge and get upset because there's a membership fee and a concierge fee. And again, understand that those fees are only there because more and more doctors are putting a price and a value to the time they spend servicing your needs outside of a face-to-face visit. And if you don't see the value, of course, you don't have to pay that price. You might think there's plenty of fish in the sea, plenty of other doctors that I might be able to go see. And the truth is, the business of medicine is the same as any other business. You will get what you pay for. That is sad, but is reality. Everything in life and in business is and will always be the same. You get what you invest in it. This is extremely true when it comes to the practice of medicine and achieving and maintaining optimal health. A doctor in a medical practice can make a ton of effort to support, to guide, to counsel, to advise, and treat you, the customer, the patient. But if you are not committed 100% or compliant or believing in the philosophy of the practice, or you simply don't have faith in the results of the proposed treatment, most likely the results will be different than someone else with better compliance, better belief, better attitude. Consider that if you as a patient want to spend zero or the minimum amount of money on your healthcare costs outside of your monthly premium because in your mind you are already spending a huge amount of money on your monthly insurance premium, then you will get exactly what you invest. Minimum amount of healthcare. No real wellness preventive care other than a quick, perhaps rushed service from a doctor who's overworked, overloaded, overbooked. And you could also expect a superficial, rushed, and very brief customer service or patient support from staff as they are overloaded, overreached, and overspent. But let's come back to you, the client, and let me end this podcast series about the American healthcare system with a few more facts that I might have told you before. I just want to sum them up. The decision to spend a huge amount of money, like $1,000 or more, for an insurance premium and carry medical insurance comes with the belief that this money will protect you and safeguard your health. That's not the actual truth. The truth is that the medical insurance company has strict rules and regulations, and most people, including you possibly, are unaware of these rules and regulations when you sign up. Many people think that this monthly premium is going to help them pay for their medical expenses. Now, I have no idea how medical insurance companies justify the skyrocketing premiums that they have imposed upon you, the consumer. But let me provide you with some basic facts and numbers, which you might be shocked by. Did you know that in 1977, the annual premium for an employer-sponsored plan was under $700? By 1987, in just a decade, the annual premium increased to over $1,700. That's a 172% increase. Today, in 2023, well, we are in 2024, but the statistics are for 2023, the average annual premium for employer-sponsored health insurance is a staggering $8,500 for one member. That is a 1,000% increase from 1977. And the actual average annual premium for a family of two or more is over $20,000. Now, that is a down payment for a small house. In many states, West Virginia, Alabama, Mississippi, Arkansas, you should consider the fact that in 1987, the annual deductible was $100. Now, the average annual deductible is about $2,000 to $5,000 and as high as $10,000 for some plans. Think about these numbers for a few minutes. Take a pause and think about whether the cost of healthcare, affordability, access to doctors who accept these insurance plans is going in the right direction for you, the consumer, where it is the beginning of an incredibly unsustainable system that will fail miserably. Consider the fact that even if you see your doctor maybe 5 or 6 times throughout the year, maybe once a month, your insurance company will pay your doctor probably less than $1,500 to $2,000 for all the visits throughout the year. And that's not the norm. Most people don't go to the doctor that often. Of course, your insurance company might have to pay for testing at the lab or some diagnostic imaging tests that have been ordered, maybe another $2,500, $3,000. But consider the fact that you're paying them more than $10,000 a year. What is frustrating to the medical team, and what I'd like to mention as I close my episode down, is the fact that the majority of patients expect the medical care provider and the medical team to know the details of what they actually signed up for. And they ultimately hold the medical team responsible for cost, as we are the first line of contact. The reality is your cost is determined by your insurance plan. There's an in-network accepted allowed rate that your plan determines, and that rate varies for the same service and the same billing code from plan to plan. And the hard truth is that when you sign up, you may need to be aware of what your copay is for each visit, more importantly, what your deductible is for that year, and what your coinsurance burden will be. You as a patient should have intimate knowledge of what you sign up for. You are signing a contract between you and the insurance company. You're providing a payment as a monthly premium, and you're expecting medical service coverage in return. There are so many plans, so many variables, and so many options that expecting your medical team to be on the phone with your insurance company to find out the details of your plan is entirely unreasonable. More so, it will delay your care because all of this has to be accomplished before you are processed by the medical staff. So one of the most important things you can do for yourself as a patient is be aware of your medical insurance policy limitations and be clear when you come to the doctor's office whether the doctor is in network and on your plan or not. Remember, I told you that finding a doctor that accepts your medical insurance plan, that has all the qualities I mentioned in the previous episodes, is a real gem, and you really should hold on to that doctor or that medical practice. Finding a doctor and a medical care team that is willing to work with you financially, that is affordable, that is offering payment plans, prepaid discounts, free financing, is an extremely valuable practice, and you should keep it close and nourish it. As a patient, you should understand that nothing is ever perfect, and no medical team will ever be perfect for you. Medical teams are composed of human beings. They require sophisticated technology nowadays, the use of different platforms of communication with you, the patient, the use of software for medical data that allows patient access, electronic prescriptions. They require a flawless system of ordering supplies to keep up with demand, etc. As a patient, please don't have the expectation that your medical team will never fail or make mistakes, whether it's a communication issue, a failure to prescribe a medication on time according to your specific needs, a failure to get you in to see the doctor in accordance to your urgency needs, etc. So try as a customer to have a realistic expectation. Consider the complexity of the processes that are involved in training, maintaining, and efficiently running a medical team that cares for thousands of patients, not just you. I have always been a very realistic person. I also like to discuss realistic information and manage expectations realistically with all of my clients. I have personally found that some patients have entirely unrealistic expectations as to what their experience with a medical practice should be. This is not meant to sound as an excuse or something that needs to be tolerated by you, the client. But in the real world, it is useful to establish real communication between you and the team that takes care of you, where you clearly verbalize when and why you are disappointed and what caused the disappointment, and perhaps giving that medical team a chance to address your disappointment, rather than packing up and going somewhere else. Because if you do that, the mutual trust needed for a sustainable good relationship between you and the practice is gone out the window. And it won't come back, even if you decide to come back to the practice. So keep in mind that great communication always goes both ways. and is likely to help you develop a sustaining trust-based relationship with whoever you choose to be your medical team in the long run and for the long haul. Again, this is a two-way relationship between not just you and the practice, but also between the practice and you, the patient. So be clear in your communication, be clear to set your expectations, be honest about your ability to afford different services, be kind and patient and understanding with the staff and the doctor, just as you expect the physician or the medical staff to be patient and understanding. And all of these are things for you to consider as a patient when you approach any medical practice and you want to enroll and become one of their clients. I sincerely hope my honest, in-depth view of things to consider when you choose to partner with a medical practice and maybe why consider a concierge practice has been informative and helpful for you. I will close here, and please feel free to share your feedback in the Facebook group, The Wellness Optimizing Warrior MD, or go on our website and send us a message through the chat with a comment or a suggestion about future episodes you'd like to hear about. Thank you for listening. If you liked the information you heard and you'd like to hear more, please subscribe and follow my podcast. Should you find the content helpful to not just you, but possibly others, please share it and feel free to leave us a review. You are welcome to join the Facebook group, The Warrior Optimizing Wellness MD. I certainly hope that you've heard many things in this podcast that made you go, wow, I did not know that, or wow, I'd like to know more. So keep listening and I'll keep talking.